Imagine this, you're faced with Mr. Smith demanding an MRI of their back, but you don't think it's indicated. How do you say no to Mr. Smith? Maybe you're not sure how to handle this request. Confronting Mr. Smith can escalate the situation, making it harder to reach an acceptable solution. Mastering negotiation skills can make the whole difference between passing and failing the SCA exam. Hi, my name is Dr. Erwin Kwun. I'm on a mission to help doctors lead fulfilling life. I help GP trainees pass their SCA exam. Today I'm going to show you a powerful framework that will guide you every step of the negotiation process so that you can handle challenging requests empathetically and professionally. Make sure you stick until the end of the video so I don't miss the free case examples that we're going to cover. Let's get right into the video. The HEART framework stands for H for hear, E for educate, A for alternative, R for reach, and T for trust. A common pitfall that GP trainees make when it comes to negotiation is poor listening. If you're not listening to the patient and they don't feel heard, then it's very difficult then to negotiate with the patient. When you listen to a patient, you're building credit. The patient feels that they're being heard and they're acknowledged. So H in the HEART framework is about making the person feel that they're heard. There are various ways of doing this. For example, if a patient is coming to you with a really bad headache, then acknowledge that. Give the patient a receipt so that they can feel heard. For example, you could say to the patient, I hear you. I can see that this pain has been awful, Mr. Smith. By doing that, patient will feel that they've been heard and you understand the problem that they're experiencing. It's vital that you show that you genuinely care for your patient. If you just say this phrase but don't mean it, the patient is going to pick on it and it can backfire. So commonly GP trainees have phrases that they use. For example, if a patient is coming with headache, they might say, I'm sorry to hear that. The problem is when you say you're sorry to hear that, you're not really connecting with the patient and you're showing more of sympathy and showing pity. Whereas if you show empathy, where you show that you understand what pain that the patient has been experiencing, that you hear them, then it is going to help you to connect with the patient as opposed to separate yourself from the patient. Let's go over the next step, which is educate. So assuming that you have taken a focus history and you've actually elicited the reason why the patient is making a request and the underlying reason, then you can educate and explain to the patient. So let's say Mr. Smith asks you they want some sleeping tablet. Do they really want sleeping tablet or do they want to sleep better? So it's important that you ask more question, follow-up question when the patient tell you that they want something by understanding the underlying reason why a patient is requesting for a sleeping tablet or why the patient is requesting for an MRI scan on the back. Then you will understand the reason why the patient is making a request. You might think that the request is unrealistic, but in the patient's mind, it's completely realistic. For example, if one of the members of the family had cancer, then they may be worried. So by getting in the patient's mind and understanding the reason for the request, you're more likely to handle the request appropriately. So it's important that you explain to the patient what's the reason you don't think an MRI scan on the back is needed. For example, you've got a patient who's worried about a cancer, for example. They are looking for a scan because maybe their cousin was diagnosed with cancer. Now, it's important that you explain to the patient that you understand where they're coming from and that you understand and validate the concern they might have about cancer. This is in the hear part. And then you explain to the patient what's a normal process when a patient presents with back pain, for example, and having excluded red flags, you don't think that a scan is required. And you can explain to the patient what is it that you're going to do for them. So by educating the patient and explaining what is request and how you're going to manage that, then the patient will feel like you're not dismissing their request, but you have considered a scan and you don't think it's needed at this point. So it's important when you're explaining to the patient, don't use words that are going to antagonize your explanation when the patient listens to it. For example, commonly GP trainees might say things like, I know you wanted a scan, but I don't think it's needed. So when you say that but, it antagonizes the patient. So it's better to say, I understand that you're looking for a scan today. I do appreciate that you're concerned the fact that your cousin was diagnosed of a cancer. Having listened to you today and explored various symptoms, I can tell you that there's no red flags that point to a cancer. So I don't think at this stage a scan is going to help us. However, I understand that you're looking for help because this pain has been affecting your daily activities. If you'd like, we can talk about how we can better control this pain. So then you see, when you're explaining the patient, you're not using but, you're explaining the patient what you're going to do and how you have come to that conclusion as a scan is not needed at this stage. Then they may feel like this doctor is quite sensitive and also sensible. So you could also explain about safety netting advice. However, if your symptoms change, you have back pain at night or this pain is still persistent, then we can revisit whether a scan is needed. So I could arrange a follow-up appointment in 4 weeks time with you to see how you're getting on with the pain relief. Clear communication is very important. You don't want to explain in a way that's going to create more uncertainty in the mind of the patient. The next step in the HEART framework is to offer a practical alternative if you don't think that, for example, the request a patient has made is something you can offer them. So think about what else you could offer to help the patient. For example, with Mr. Smith, because he's been having this back pain, then we can offer an alternative as in how we can manage his pain, and also offering him a follow-up appointment, which we're going to discuss in the next step, as in how we actually have a follow-up. So it's important that you have an alternative, otherwise the patient is going to leave the consultation without anything and you haven't really addressed their need. So understanding the patient's needs and making sure that you differentiate it with what the patient wants is important. If you don't understand the difference between patient's need and patient's want, it can be difficult then to manage it. Sometimes trainees under exam condition, when they feel pressured, they just cave in and give the patient what they think they need. But it's important that you as a doctor have your professional judgment, understand what's needed in this consultation and what the patient wants. If what the patient wants is not really needed, then it's important to explain this to the patient. So for example, if you've got a patient who's coming to you with a cough for the last week and requesting antibiotic, when you think it's a viral illness, then it's important that you explain to the patient about the cons of having antibiotic when it's not needed. For example, it could lead to side effects. They might have diarrhea and vomiting. It can also cause resistance. So when they are more unwell in the future and have a bacterial infection, then the likelihood of antibiotic working is going to be less. So when you explain this to a patient and then you offer an alternative, for example, then you tell a patient, normally I would expect that this cough is going to improve on itself without having to give you any antibiotic at this stage. However, there are things that you can use to help, for example, over-the-counter medications to help. You can take some honey and lemon that might help you as well to recover faster. So by giving the patient the advice and alternative measure that they can use, then the patient will feel like there is a reason why you're telling them that the antibiotic is not needed and also what is more appropriate in this situation. So it's important that you practice this negotiation, because it can be difficult to say no to a patient. But if you're a good doctor, it's better to know when not to prescribe something. The patient is going to respect you for that, most patients at least. Have you found the insights in this video useful so far? If so, you might be interested in SCA Blueprint. Just click the link down in the description below and sign up, and you will get a teaching from me every day for the next 7 days. So the next step in the HEART framework is R for reaching an agreement. So far we've discussed about the patient's request, we've explained the patient our concern, and then also offered an alternative option that's more sensible. Then it comes to a point where you and the patient need to make an agreement. So not all the time you will have agreement. There have been times as well in my career where patient might disagree with me, and it's okay if the patient disagrees with you. As long as you've done your best, patient might not always agree, but you want to do your best so that the patient understands what's going on and what is it that you want to achieve for them and addressing their needs. So reaching an agreement is where a shared decision making is one of the things that is important in the SC exam. So when it comes to reaching an agreement, it's important that you involve the patient and use inclusive language. So for example, we could see you back in 4 weeks time to see how you've responded to the back pain, Mr. Smith. By using this language where you include the patient and showing the patient that you're making a decision together, then it's going to be more likely that the patient will be adherent with the treatment plan. Now, there are times when in lifestyle modification, you might not know what is it that would be helpful for the patient, and it can be helpful to ask the patient, for example, as in, I understand that you were hoping for some help today and you were hoping hoping for some tablets to lose weight. As I discussed, it's important that we make sure that you lose weight. So at this stage, a tablet is not required, and there are other things that we could do in terms of things that you can do yourself. What do you think is going to be your preference in terms of lifestyle, exercise, diet? Is there anything that you'd like to start first? So then you're giving the patient more responsibility as in what they'd like to start first. Then they're more likely to be incentivized to do it. Let's come back to the patient who's been presenting with a cough, and you agree on a plan that antibiotic is not needed because of the risks that you have discussed with the patient. So then you can agree with the patient. So you can tell the patient, discuss with you about what we can do. Just want to make sure that we have an agreement as in what's the best step forward. So would it be possible for you to use honey and lemon and then see how things go for the next week? And if you still feel like this is persistent, then I'd like to see you again to see whether there's anything that might need to be done afterwards. However, I would expect that in a week time, this cough is going to get better. So you're setting the expectation and making sure that you and the patient are on the same page. The last step in the HEART framework is trust and follow-up. It's important that this element of trust is reinforced. Patient understand that there are things that you can do and the things that you can't do. For example, if the patient has requested for an MRI of the back, but you have said to the patient that this is not indicated, and you will also explain what your management plan is, making sure that there is a clear plan as in what you're going to do, and the patient understand that plan. For example, things can change between when you see the patient and in 4 weeks time. So the patient might need a scan if, for example, develop pain that gets worse, or if they have neurological symptoms, for example. So by having this clear advice to the patient and making a follow-up plan, it's going to make sure that you're safe in your management plan. So it's important that you maintain compassion when you're discussing with your patient, even when you're telling them about what you'd like to do. When the patient feels that you care for them and you're here on the same team as opposed to confronting them, then they will be more receptive to your suggestion. A common pitfall is to try and confront the patient as if you are the one that's stopping them from having this MRI scan. They will feel more like you're obstructing them. Whereas if you show them that you're here to find a solution for them and you're on the same team as them, then you're going to find common ground and more likely to reach an agreement with the patient and have a successful consultation. Now let's see how we apply HEART framework. A patient who is requesting antibiotic when they have a viral infection. So H4 here. So what you can do is you can say to the patient, understand you're feeling very unwell and want to get better quickly. By saying that to the patient, they will feel like you've listened to them, they're heard, and they feel understood. Remember, human beings have a need to feel heard and understood. When they feel heard and understood, then in their mind, you will be a doctor who is more of a listener and there for them. The next step is E for education. So you explain to the patient that antibiotic is not effective for viral infection. In fact, it can cause you to have side effects such as vomiting and diarrhea. It can also build resistance. So when you do feel like you're more unwell or you have a chest infection that requires antibiotic, then it might be an issue because of the resistance. So by educating the patient on the problem of taking antibiotic when it's not needed, patient is going to be more aware of the risk of the antibiotic. Then A for alternative, then you can offer an alternative to the patient. So you can explain to the patient that this viral illness, I would suggest that you take some over-the-counter medications. You can also take honey and lemon that might help with the symptoms that you're having. Then R for reaching an agreement. So you can explain to the patient as in sharing the decision making with the patient. So let's agree on a plan, Mr. Smith. So you've been having this cough for a week. Let's see how things go once you started using the over-the-counter medication. Make sure you get some rest and keep well hydrated. And then if things change, please get in touch with me. But I would expect that in a week time, things will resolve. So you're reaching an agreement with your patient. And then T for trust and follow-up. This is where it's important that you highlight what is it that you can do and what you can't do, setting clear boundaries. So it's important that you explain the patient, I cannot prescribe you antibiotic for a viral infection, but let's arrange a follow-up, see how you're doing. And by having that clear plan and explaining what you can do and what you can't do, then it's going to be a better way of communicating this no to a patient, so they understand that what you have done for them and readdressing their expectation appropriately. By applying the HEART framework, you're going to be in better position to handle challenging requests from a patient. I'd love to hear from you. What was the most difficult clinical encounter you've ever had? Write down in the comment section, and how did you manage it? If you found this video useful, you might want to watch the next video here, in which I discuss with a GP trainee who passed the SCA in his 4th attempt. Click here to watch the video. Take care everybody. Bye bye.